This week's episode of Plastic Surgery Uncensored, I'm very excited. I have two wonderful guests, and we're going to talk about rhinoplasties, the journey of rhinoplasty, when, where, why, how, and everything else you need to know. You're definitely going to want to tune in. It's going to be exciting. It's going to be informative. So check out this week's episode of Plastic Surgery Uncensored. Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. And I am very excited. I'm excited because this week's episode is about rhinoplasties. Anyone that knows me, follows me, knows that I love rhinoplasties. It's probably one of my favorite procedures to perform. And I am excited because we're joined by two fantastic patients who have honored us today by joining us because I have no shortage of information I can share with you about rhinoplasties, everything you need to know. But I always find that talking about subjects in a vacuum is not nearly as exciting and informative as speaking with someone who maybe had undergone that procedure. They can corroborate, confirm, or disagree. And I think it allows the listener or the viewer to really make sure and get a more authentic feel. Because, listen, I'm biased, right? It's not like I had my nose done, so I can't really speak that much of the patient journey. And I think when you hear it coming from patients, especially the two wonderful patients we have today, I think it'll help solidify some of the concepts. So welcome, ladies. We'll start with Emily. Why don't you introduce yourselves? And then we're going to get to know a little about your backstories.
Well, thank you for having me today, Dr. Roddy Raban. I'm Emily. I'm from Fresno, California. And I obviously got my rhinoplasty / septoplasty done with Dr. Raban. Thanks for having me.
Of course. Sharon.
Hi, Dr. Raban. Hi, Emily. Thank you for having me. I am Sharon, and I'm from San Pedro, California, and I got my rhinoplasty in September of 2020.
Right. And we also did
my chin augmentation.
Right. So we're going to chat about those things because I think both of you have every patient that comes has some uniqueness about them that makes their journey a little bit special, and we'll talk about them. So what I like to start out with is the idea of what's wrong with the nose, right? So people don't come to you because they love their nose. They come to you because they don't like their nose. And 9 out of 10 patients who come to me, when I ask them, so how can I help you? They're immediately say, well, I'm here for my nose and I don't like my nose. And then of course that followed up with what's wrong with your nose. And almost everyone says something to the following effect. My nose is a little big. It doesn't really fit my face. It's just asymmetric. And I feel like, it's just not balanced. I want something a little bit smaller in the instance of a female. I want something that's feminine in an instance of a male. I want something that's masculine. Oh, by the way, I want something that's really natural. I don't want anyone to know. Does that sound familiar, everybody? What does all that mean? All that means nothing. It means nothing. It's air. It's nonsense. It's not useful. Because we all know that the word natural, balanced, something appropriate, feminine, all those are subjective or general terms. They mean a lot to you, but may mean something different to someone. We all know someone walking around with arguably a terrible nose job who thinks that nose is phenomenal, natural, balanced. So the last thing you want to do is describe to your surgeon that you want anything, no less your nose, done that way, because you leave it up to interpretation. And God forbid your surgeon's feel for natural or balanced or feminine or masculine is different than yours. You're pretty screwed. So what I always like to do is I like to get into objective descriptions. What specifically is it about your nose you don't like? Is it the hump? Is it the bulbous tip? Is it that your nose is droopy? Is it that it gets wide when you smile? What is it specifically? And so we did that in both instances. And for a lot of patients, it's actually very difficult. You ask them that. They're like, do you have a mirror? Because you're like, I've never actually really had to describe what's wrong with my nose. I just hate it. And so it's very important that you do that exercise so that you know what's wrong. Yes. And then a lot of people are like, well, you're the surgeon. Whatever you think, or what do you think, or you're the artist. That's also a terrible way to approach it. Because yes, I have my opinions. And yes, you came to me because you like my work, but you never allow someone else, not your husband, not your boyfriend, not your mom, not your surgeon, decide for you how to end up. You do it collaboratively. That surgeon will give you input, will give you guidance, but will never decide for you that, oh, you need to have a scoop nose because I think it looks better on you. That's crazy. That is just nuts. So, Emily, what was wrong with your nose?
So obviously I came to you, Dr. Raban. My nose was severely crooked to the left-hand side, which really gave me a lot of anxiety in social situations. And then along with that, I couldn't breathe on my left-hand side due to the crookedness causing a deviated septum. And then along with that, I was also really self-conscious about the slightest dorsal hump, but I really focused on it. So for those reasons, I decided to get a rhinoplasty.
Right. And so when you came in and you say your nose was crooked, you had a legit crooked nose. I can't tell you the number of patients who come in. Like 90% of patients tell me their nose is asymmetric and crooked. And you and the rest of the world, like every supermodel, every actor, every actress, everyone's nose is crooked. That's not relevant. What's relevant is, wow, your nose is crooked. And indeed, your nose is really crooked. And as such, your septum was deviated. And as such, you had significant breathing issues. So everyone comes in and says their septum is deviated. Who cares? I mean, your septum is never straight. I can tell anyone listening right now, without ever having examined you, your septum is deviated. It just means that it's not straight. What matters is that impacting my breathing or is that impacting my cosmetics? And in your instance, it was. Sharon, what was wrong with your nose?
I broke my nose in 2019 and it was broken up here and it kind of accentuated the hump that I always had, my Italian nose. So I don't know, it made me more self-conscious about it. And it was just like, I had a deviated septum because of how I broke my nose. And it was just like Emily just made me very self-conscious. After I broke my nose, it was just something that I kept looking myself in the mirror and it's just like, I never felt like that, never felt like I didn't like how I looked. And it's not like you can lose a pound or two and feel better by yourself. It's right in the middle of your face. So I think it was more psychological for me, but also it was broken and had to be fixed.
Yeah. So the word it's psychological for me is it's for everyone. It's psychological for everyone. Because even if your nose is crooked and you can't breathe, in the case of Emily, which was really, really, really crooked, you breathe through your mouth. Everyone does their nose because it's psychological. You don't need to do your nose. You do it because you don't feel comfortable. You do it because it makes you self-conscious. You do it because you want to be able to take photos and not look at your focus on your nose. You do it because when you want to have conversations with someone, you don't want to stand on your so-called better side. Everyone does it because it's aesthetic, just like a breast augmentation isn't necessary. That being said, doesn't mean that it's any less worthy than removing lipoma. They're all important in different ways and no one needs to justify it. But the point is that you want to make sure that if you do it for a reason that you're going to end up having a happy outcome. Now, Sharon, we also end up doing your chin. So tell me, did you know about your chin maybe perhaps being benefited from an advancement, or how did that come to be?
So I never really thought of doing anything to my face other than my nose. So when I first came to you and you mentioned the chin, I was kind of like, wait, what? Like, I never thought about it. And I never really paid attention to, like, I remember you saying, if you open any magazines, you'll see that every model has a very strong jaw. And I never paid attention to it because I honestly thought it was something natural. They were born like that. I never, my mind never went there. I didn't even know that, that was a possibility. And when you brought it up to me, at first I was very hesitant and kind of just like, okay, I'll take your suggestion, but I probably won't follow up on it. And then I went home and my boyfriend and I started looking at your portfolio and the before and afters. And we started noticing this time around that who had the chin done just by looking under the rhinoplasty section. And I was like, oh my gosh, like I so have to do this. So that's how it kind of played out. Definitely a great suggestion. I always tell people, I don't know what I love the most, my nose or my chin.
Well, I can tell you I love your chin better because I'm just a chin man. But I think that's just an important conversation because rhinoplasty and ear pinning have nothing to do with each other. Rhinoplasty and breast aug have nothing to do with each other. You don't ever see me, everyone come into my office, and while they're there, I'm like, hey, have you ever thought of doing your eyelids? Just that's not my personality. I never promote or suggest anything that you haven't asked for, because it's just not, I don't know, I don't like the style of it. That being said, you come in for your nose, you look at your profile. There's no way I can really give you good advice about your nose without talking about your jaw. Those two are sisters. They're married. They're twins. If someone comes in and they have a prominent nose from profile and they'd like that profile to be improved, and they have a mildly weak chin or severely weak chin, I would be remiss not to mention it to you. I have to mention that in order for your profile to look the way I know you want it to look, you may not appreciate that the chin is participating, but it damn well is. So in your instance, and in the instances of half of the patients who do chin augs, I have to mention it to them, and the other half, they come and mention it themselves. What's important is just understand that when you're looking at your profile and you're like, I don't like the way this looks. My nose looks big and I don't know, it comes off my forehead. You should be aware that your chin may or may not be contributing, and recognize that if your chin is in better balance, it takes some of the pressure off of your nose having to be amazing. So when your jaw is strong, your nose almost is less important. That's the idea. So anyways, we did that. You guys did an amazing job. There's a few things that we ask patients when they come in. What are those? We ask about if they've ever had any trauma. Why? Because if you broke your nose versus you didn't, it's important to know. It doesn't matter if, a lot of people feel ashamed that they're getting their nose done. So they're like, well, I broke it when I was playing soccer. Because in their mind, they justify it. It doesn't matter if your hump came from birth, from soccer, from Jesus. It doesn't matter how you got it. What matters is you have it and you don't like it. And that's the end of that discussion. But of course, we like to know if you have trauma, and then we like to know if you have breathing issues. Why? Because your nose was designed, is created for breathing, period. It was never designed to be cute or pretty or balanced or nice or harmonious. It's an organ. It's for moving air. So if you come in and you can't breathe and you do a rhinoplasty and your breathing is not addressed, your breathing will get worse. And if you come in and your breathing is amazing, I have no problems, and you go get a cosmetic rhinoplasty and your breathing is not addressed, your breathing will be shitty. Your nose will have breathing issues if your breathing is not in discussion during your cosmetic rhinoplasty, because invariably the procedure is making your nose smaller in some way. Straighter maybe, hump, but it's smaller. So if you are creating an organ that moves air and it's big and then you make it smaller, well, then don't be shocked that you go read review after review after review that, oh my God, I had my rhinoplasty and now 2 years later, I can't breathe. People who follow me, people who read my stuff know that I'm very big on breathing. The problem is you usually go to an ENT for breathing and a plastic surgeon for cosmetics. And the worst thing on the earth you can do is go to an ENT, have them fix your breathing, take your septum out. A year later, go see a plastic surgeon and then have them do your rhinoplasty. Terrible, 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 terrible. Why? Obviously, you've now had 2 surgeries, but more importantly, is I need the damn septum. So I'll elaborate that a little bit and you guys will attest to it. But there's a principle, which is I need to do something structural and your breathing is important. Okay, guys, in addition to your exam, so let's shift gears a little bit to the exam and let's talk about some of those nuances. So I asked you guys and I talked to you about skin quality. Skin quality. The first thing I tell you during your exam. So you can have thin skin, thick skin, or average skin. Why that matters is when you do a rhinoplasty, you lift up the skin, you change the bone, you change the cartilage, you make it, ooh, that looks pretty. And then you put the skin back on over it. And then you do what? You wait 12 to 18 long months, not 12 to 18 weeks, 12 to 18 months, during which time the skin starts to shrink wrap over the new envelope. And then all of a sudden, lo and behold, there's your result. If you have thin skin, you see everything. Oh my God, I love my tip. It's so cute. But what the hell is this thing? I never saw that before, because the skin is thin. And if your skin is thick and oily and sebaceous, you're going to come back and be like, wow, this sucks. I came in with a bulbous tip and it's kind of still bulbous. You didn't do anything. In reality, I did everything the same as I did for the thin skin person who thinks their nose looks like amazing. Skin matters. So ladies, you guys are in. Emily, how far out are you from your nose?
I think in March, I'm coming up on 6 months.
Okay, 6 months. And Sharon?
About 3.5, 4 months.
Okay, perfect. You guys are right in the thick of things. You're right in the eye of the hurricane, right? You're in the ugly phase of the healing, meaning not that you look ugly because you look gorgeous, but ugly as in it's just sort of like, ugh. It changes every day. Every morning you wake up, you have some sushi, and the next morning you're like, oh my God. So this is a matter of your skin. So Emily, tell me about your journey in terms of, we talked about skin. What kind of skin did I tell you you have?
Yeah, so you told me that I had thin skin. So not only is my healing, I think, a little bit quicker, but I also didn't have much swelling after surgery. I think in comparison to some of the other skin types.
And Sharon?
I have thick skin.
So
thick skin. Yeah.
You guys now know why you were selected. We have thin skin and we have thick skin. And that's excellent because everyone listening is going to want to understand. So what did you, so Emily, I do agree with you. You did have thin skin. Your nose is at 6 months, still swollen, no doubt about it, but your swelling post-op was minimal and you're just flying through the recovery in terms of not needing taping and massaging and all the nonsense you read online because your skin is cooperative. Sharon, how have your experience, what was your post-op like?
It was great as long as I didn't eat salt. When I ate salt, it was just like I blew up, my entire face just blew up. But I can definitely tell that there's at night, my nose looks a lot smaller than during the day. When I first wake up, sometimes it's like I have to do a double take in front of the mirror because it's so swollen. And there's times that I forget and I'm just like, oh my God, it looks so big. So it's just, I can definitely see how, for people that have thinner skin, they see less swelling, but I can definitely see, especially like here and here around my tip. And in fact, my tip is still kind of numb and it's like really hard. And it's just, I know we injected, I think it was last month or a month and a half ago, and I'm coming to see you again next month, but it's just like, I always ask my sister, I'm like, look, touch my tip. I cannot feel anything still. And it's so swollen that,
right.
it's just.
So you guys now represent what we talk about.